Okay, so this is Dave. He just finished our program on Tuesday. Today is Thursday, and we did our final evaluation. And we'll get to that in just a second. But how did you come into our office, Dave? Tell the people how you came here.
Around Christmas time, getting ready for Christmas and everything, and I was feeling pain in my toes. They were kind of numb. I didn't know what to do. Didn't know whether to go to the doctor or go to Dr. Watt. I knew Dr. Watt because I was coming to him for help with my back.
Yeah, we've been seeing Dave for a little while, just in chiropractic care. He just comes periodically, just kind of keep himself as loose as possible because he is a little bit stiff.
Yeah, right. So anyway, I was just talking to him about it, and he mentioned this program, and
okay.
So my wife and I thought we'd give it a try after we talked about it.
So we had you come in and do an evaluation. Do you remember what your numbers were when we did the evaluation?
I don't remember the numbers. I just remember my toes were pretty dead.
Okay, so we'll go over it. So when he came in, he scored a 26 and a 24 with a total of 72 and 74% loss of sensation. So, and it was worse than what you realized, right, when we did the evaluation?
I didn't realize
because there was a lot of things that we did that he scored like a 0 or a 1 on, and he was pretty surprised. So then your wife came in. We did the consultation, and I knew you before. We've already had an established relationship, but did you feel like there was any pressure to do what we wanted you to do, or what we were explaining to do, to be able to what we want to do so we could help you, I guess is the way to say that. Because that's one thing for people that are watching this video. They always feel like people are going to try to sell them something. And, I don't try to sell them, but I absolutely am going to tell them what we can do to help them and what needs to be done, and it's their choice whether they do it or not. So you went home, talked with your wife about it, and you decided, yep, we're going to jump on and we're going to start doing this. Okay. How soon after you started in the program did you start noticing changes in your feet? Did it take a little while, or was it fairly quick?
I would say changes in the feet were a couple of weeks.
Couple weeks? Okay.
Really
that's actually
long.
pretty quick then.
Yeah,
that's actually pretty quick.
Things started to ease up a little, and
it
would go, sometimes it was hard to tell because one day it would be like the same and the next day would be better.
Yeah, it would be up and
So
down a
just
little
going
bit.
back
And that's
and
that
forth.
in the healing process, that's for sure what
It's hard
happens.
to know exactly.
Now, one of the things that Dave did really well on, and I have to commend him for that, is he really did well on the stuff we did on the dietary changes. He was really active on, hey, can I do this? What about this? And I think that was one of the big benefits you did. Can you tell a little bit about your experience with the dietary changes we did?
7 years ago I was 280. I went on some diet plan and was able to get down to 240, but then I crept back up to 255 about Christmas time.
Mm-hmm.
Maybe some of it was because of Christmas, but anyway, and that happened pretty quickly. I started to notice that I was losing weight.
Yeah. So you totaled out about 30 pounds of weight loss, right?
Yeah.
During our program.
I've been right around 220 for about 3 or 4 weeks now.
Right.
Maybe
Probably a little bit longer, actually. Yeah. Yeah, because for the first little bit, it's like, hey, I've lost this much. Hey, I've lost this much.
Yeah. Well,
and it kind of plateaued a little bit, but you've lost. I mean, losing 30 pounds is significant, especially. How old are you?
Almost 70.
Almost 70. And most people don't lose weight and they're almost 70 unless it's because they're having some really bad health issues, right? Most people are gaining weight when they get a little older. So that's excellent. That really shows that you really worked hard, and the program that we do really is beneficial. So you got down 30 pounds. In fact, his wife and myself still keep giving a hard time because he wears a suit to work and he needs to get a new one.
I got the suit.
Did you get it done? Oh, okay. You got it tailored? Oh, I didn't.
The shirt she's still getting that.
Yeah, because he was having to put holes in his belt,
It's still like this, so I need some new shirts.
Yeah, so that's awesome though. That's good. I didn't even notice it because we didn't do the therapy today.
Yeah.
So we went over. We did the exam today. Okay, and I can't remember, we've been talking, so I can't remember what I explained, but it was awesome. I was very actually surprised how well he did. So let's go over it again. He had a 72 and a 74% loss of sensation when he started the program. Today, when we did the evaluation, he had a 15 and a 10% loss of sensation. So his numbers went from 26 all the way up to 77, and then 24 to 81. That is huge. That is so good. And you know what? He was very dedicated. He did a job, but it also because of, fortunately, I found a program to help patients with neuropathy, and it's been successful with these patients. So that was awesome. Tell us a little bit about your experience just coming to the office. It's kind of different because you've been here obviously multiple times before and stuff, but just kind of how what you felt at the office and kind of just your experience here at the office.
It's always been a good experience to come here, and coming here, it was once a month,
right?
And now it was twice a week.
Right. So, yeah. We saw you a lot more regular.
So it was just a good experience.
Okay.
And just whatever the flow happened to be that day.
Right. Yeah. Sometimes we'd do therapy first. Sometimes we'd do the machine first. Just depending on our other patient load and that. And he was really good about that.
To watch a few movies.
That's right. Yeah. Yeah. Because you got to watch movies basically when you're doing the therapy. You probably watched. So he came in when he started therapy. It's about a 4-month program. You came in January, and it's the end of May now, or middle of May. So, So I mean, we're right. It's actually almost 4 months exactly. You started on the 11th, and today's the 10th.
Okay.
So yeah, almost 4 months exactly. So, but we just want to say thanks to Dave because he did a great job. But the numbers speak for themselves. I can't predict. I can't fudge the numbers. The test that we do is strictly based on what you feel. I can't do anything for it, and that's why to me it's so powerful in the reality of how much success we truly are having with his patients. And then today, afterwards, he's like, okay, what can I do with the dietary things? And so we had some more talk on that, and I'm sure we'll have some more conversations on that as you come in. But the nice thing is how well he's done, and he really has worked hard. But the results show for themselves. So is there anything else you'd like to say to people watching the video?
I'm glad I did this.
Awesome.
I was really worried at Christmas time with this diabetes too, whether I had it or not, and whether
have you checked your blood sugars? Because
I need to do that.
Yeah, we really need to have you go do that so that we can actually see what they were.
Been coming here twice a week.
Yeah, right. Yeah. So, all right. Well,
and
I'm sure that those have drastically increased, or not increased, but decreased. I'm sure that they've done better just because of how much better you've done overall. So, and that's the thing we don't just take care of the patient and don't throw something on your legs to try to help you. We want to take care of the whole body and have success with everything getting healthy. All right, well, thanks so much. Appreciate it.